recording, we'll discuss eye anatomy. We'll start with external eye anatomy. So we've got the eyelids, also known as palpebrae. Their function is to lubricate the eye by blinking, and also that helps prevent dust and other debris from entering the eye and causing irritation. The eyelashes on the ends of the eyelids are also responsible for helping to prevent foreign matter from entering your eye. We also have the tarsal glands, or if you prefer, meibomian glands. These secretions that come from the glands help keep the eyelids from sticking together. That's not really something we normally think about, but if you've ever been really, really sick and you woke up one morning and your eyes were, people like to say they were matted shut, that's kind of a terrifying feeling, and so we actually really like these secretions. We just don't think about them a whole lot. And then we have the conjunctiva. This is technically a mucous membrane, and it lines the inner surface, or basically the backside of your eyelid. It's also continuous with the outer surface of the eyeball itself, so it covers both parts. Now, if we experience inflammation in your conjunctiva, we call this conjunctivitis. So we know that itises are inflammations. A lot of people know this as pink eye. Now, usually when people think of pink eye, they think of some sort of bacterial or viral infection, and that's true, but you could also experience pink eye because you suffer from allergies. Maybe some sort of physical contaminant has gotten into your eye, or maybe some sort of chemical is irritating your eye. All of those will also technically cause inflammation of the conjunctiva, so we could experience conjunctivitis in quite a few different ways. All right, just to kind of see where we're at, we've got the upper and the lower eyelid. We've got those nice eyelashes that we're familiar with. The tarsal glands that we mentioned, you can see they are above and below the eyelids respectively. And then you've got that conjunctiva. Remember, it starts on the back side of your eyelid, and it is continuous with the eyeball, so it does cover that outer surface as well. Okay. All right, so what else do we have? We've got the lacrimal apparatus, and y'all know I just like saying the word apparatus. This is a couple of different structures that work together to distribute and then remove your tears. So first of all, we have the lacrimal gland, which is responsible for producing most of your tears, volume-wise. These live on the lateral sides of your eyes, okay, so more towards your ears. Okay. Now the tears themselves, as you produce them and secrete them, they are going to drain into your nasolacrimal duct. Okay, so the nasolacrimal duct, those tears are going to drain into the sinuses. Okay. Now your nasolacrimal, okay, naso, your nose, right? Where does your nose sit on your face? It sits medially. Okay, so your lacrimal glands are lateral, so we tear from almost the outside, right, the lateral side, inwards towards the medial side. Now, nasolacrimal also suggests that we have this connection with the nose, which we totally do. So if you've ever cried and your nose got a little leaky as well, that's why. Okay. Now, we can move your eyeball in a lot of different ways. We have extrinsic eye muscles that help with the position of your eye. And we can actually do quite a few eye movements. So we've got 6 extrinsic eye muscles to speak of. If these muscles do not move in a nice coordinated fashion, you could suffer from diplopia, also known as double vision. Okay. If any of these eye muscles are particularly weak, you could suffer from cross-eyedness or strabismus. Okay, so those are pretty common eye conditions. Now, these first 4 names, you're going to like these names, y'all. Lateral rectus moves the eye laterally. Medial rectus, medial. Superior rectus, superiorly. Inferior rectus, inferiorly. Like, those are pretty good names, right? Then we have the superior and inferior oblique muscles, okay? And those are just a tiny bit different. So if you think about these first 4, lateral, medial, superior, inferior. So you can basically look up and down, left and right, okay? So kind of process that, like, all right, we can move up, move down, move left, move right, okay? But your eyes can actually move in 360 degrees, right? You can make a full circle with your eyeballs, okay? So we need muscles that help transition from, so if you're looking up and now you want to look left, we need a muscle that helps with that transition. Okay, it's more of an arced pattern. All right, same thing if you're looking left and now you want to look down. You got to move in kind of an arc pattern. That's where these oblique muscles come into play. They're going to help us move in a 360-degree manner instead of just up, down, left, right. We're going to move in circles. Okay. Now, you have 3 different cranial nerves that innervate your eye muscles. Cranial nerve 4 innervates your superior oblique. Number 6 innervates lateral rectus, and number 3 innervates the other 4. Okay? If we count these 3, and if we include your optic nerve, which doesn't do muscles, it just does vision, remember, okay? You have 4 cranial nerves that are devoted to your eyeballs in some way, shape, or form. That is 30%. Y'all, 30% of your cranial nerves are devoted to your eyeballs, okay? That's pretty significant. That should tell us that our vision and our eye movements are pretty darned important. All right, so just so we can visualize, we've got superior and inferior rectus. We've got lateral and medial rectus. So again, we can look up and down, left and right. Okay, up, down, lefts and rights. And then here is superior oblique. Here is inferior oblique. And remember, these 2 work together so we can, well, these 2 work with the other 4, I should say, to do the 360 round and around and around. Okay, and then on this angle, you can really see how everybody is attaching to the eyeballs themselves. All right, what's next? Here we go. Let's talk about the eyeball itself. You know that the eyeball is spherical. It is round. It's also hollow. It's not empty hollow, though. It is full of fluids that we'll talk about in a little bit. You have an outer wall that surrounds a couple of chambers that we'll discuss, and we also have the function of supporting the lens. Now, your lens, which a lot of people have heard of the lens of the eye, this is responsible for helping focus light as it enters the eye, and we'll mention the lens a couple of times throughout. Now, your eyeball itself, we've got 3 layers. Each layer, of course, is made of multiple parts, because of course it is. You've got your fibrous tunic, your vascular tunic, and your neural tunic. Okay, remember, tunics are layers. And you can see here that your fibrous tunic is your sclera and your cornea, yada yada, but we're going to do one at a time anyway. So let's start with, here's our picture real quick, just to get us oriented to what we're talking about. You can see our 3 layers here. You've got this white layer, this more colored layer, this like yellowish colored layer, this pinkish layer, and then we've got that yellow inner layer. Okay, so we do have our 3 distinct layers here. And you can see all these words. It's not going to shock you to learn that we're going to talk about what all these words do. So here we go. Let's start with the outer layer. That's your fibrous layer. We have 2 components. The sclera, which is basically the white part of your eye. Okay, this is formed from dense fibrous connective tissue. We've got a lot of collagen and elastin fibers in here, so we have some flexibility to your eye, which sounds kind of weird. We don't necessarily want to think about our eye as being kind of squishy, but technically your eye is a little squishy. We also have blood vessels and nerve fibers here as well, so we have to feed the eye. We have to give nutrients and oxygen, and we're able to feel if something touches our eye because we've got these nerves. This is also where your extrinsic eye muscles insert, so this is where they attach. They do attach directly to the eyeball itself, which that makes sense. If you want to move the eyeball, you're going to have to touch the eyeball, right? Now, if we come around to the very front of the eyeball, very anterior portion, we see the cornea. This is the transparent layer, okay, in the very front of the eye. It is technically continuous with the sclera. So the sclera, remember, the sclera is the white part of your eye. So you've got white all the way around, but as you move towards the very front of your eye, that becomes a clear layer. That's your cornea. Okay, it does cover the pupil and the iris, which most people are familiar with those two structures, but we'll refresh on that here in a second. We have no blood vessels here, so this is avascular. Okay, but you do have nerves, all right, so you can still feel when something or someone touches the cornea of your eye. If you wear contacts and you're continuously having to touch your eye, this does not come as a shock to you at all. Because there's no blood vessels here, this actually makes it a really good tissue for transplants. You can have a corneal transplant if you need one day. So there you go. All right, so here we go. We talked about the sclera, the white part, all right, so it goes all the way around, but if we go forward anteriorly, here we go, eventually that very anterior portion becomes transparent, so that is the cornea itself. Why do we need this to be transparent? Because we need light to actually go through this part of the eye. So we don't really need light to come up here, all right, so think about what would be up here. This would be your head, right? Light's not coming up in your head. We want light going through the front, so we're going to need that to be a transparent layer. Alright, so those are the first two. Remember, those comprise the fibrous layer. So next up, we've got the middle layer, the vascular layer. Now this one has 3 components instead of 2. We've got the iris, which is the pigmented part of your eye. So that's the, oh, I have green eyes, or I have blue eyes, or I have brown eyes. That's the green, the blue, the brown part. Okay. The pigment itself, so it's not just there for show, like it's not just there to be pretty. It helps limit how much light can reach the retina in the back of the eye. We'll talk about the retina a good bit here in a little bit. But we don't want to let too much light into the retina because you could damage the retina and that would be bad. So the pigmented part of the iris helps control how much light gets back there. You're also going to find some smooth muscle in this area that helps control the size of the pupil itself. All right, so remember the pupil is the hole in the center of your eye. It tends to look kind of black. Now we can make it bigger or make it smaller. So we can constrict or we can dilate your pupils. If we're going to constrict, we have probably got too much light, right? It's too bright outside, something like that. Or we're trying to look at something too close to our face. And so we narrow the pupil itself. The hole gets smaller. If we're in a dimly lit room or we're trying to look at something farther away, we're going to want to let more light into our eye, and so we will do pupil dilation instead. Okay. Now the iris itself is located between the cornea and the lens. Okay. So kind of that middle point. And then it also helps form the anterior portion of what's called the uvea. Okay. Don't confuse that with the uvula in the back of your throat. They're different. Okay. Now, your ciliary body, okay, we're going to find more muscles here. These are basically tenuously connected to the lens. These are responsible for helping us focus on the things that we are looking at. And then we have the choroid, right, our third and final component of our vascular layer. This is how we feed the retina. Okay, so again, your eyeball is living, so we're going to have to get oxygen, we're going to have to get nutrients all the way back to the retina itself. And you're also going to find melanocytes here. All right, now you are already familiar with melanocytes. These create pigment. Okay, so even though we can't really see on a regular basis the choroid part of your vascular layer, it does have pigment in it. Alright, so here we go. We said the iris was the pigmented, the colored part, so we got blue eyes or green eyes, something like that. The pupil was the hole in the middle, so we can dilate or open up, or we can constrict and go back to our normal size. Okay. We've got the ciliary body that we mentioned being attached to the lens. We said we can kind of change the shape of the lens to accommodate for whatever we're looking at. And then last but not least, that choroid layer, this yellow thin layer. Remember we said this is how we're going to feed the retina, and so you'll see the retina is right next door and all that good